Hi everyone, my name is Andrea Harding. It's been a really good experience with you all in class this year. The public health practitioner that I interviewed's name is Sally Baus. She's the Administrative Programs Manager at the Oklahoma State Department of Health. In her early life, Sally began working as a cosmetologist. She knew she didn't want to go to college right away after high school. She eventually became an instructor at the cosmetology school that she worked at. She graduated from high school in the late 70s, early 80s. During this time working as a cosmetologist, she was friends with many people of the LGBTQ community. Um, those friends and friends of friends within the community um, were starting to become ill, and some even died from a new disease, what Sally termed it as HIV. At the time, HIV was highly stigmatized, and many died alone in hospitals. And Sally knew that she wanted to be part of the conversation and a solution to help. So Sally went back to school. She became a health educator. She described that going and getting a job at the Oklahoma State Department of Health was a little bit difficult. So she started out as a disease investigation specialist in sexual health and harm reduction. Currently, Sally is over what we call the central office, or the main office here in Oklahoma. So she works for the entire state. So the demographic makeup of Oklahoma in 2020 is displayed on this chart. It's not as diverse as other areas, but they do take into consideration the populations that they work with. They also take into consideration insurance status, as is normal for public health. So in 2020, 16.3% of Oklahomans under 65 were without insurance. I think it's also important to know that the median household income in 2020 was a little under $57,000 per year. So Sally is currently the program manager over the infectious disease surveillance and collaboration. Her team coordinates all training for internal and external partners on an infectious disease, and that also includes sexual health and harm reduction as well. So to equate her career to the 10 essential public health services, I've picked number 1, 3, 4, 5, and 6. For assessing and monitoring population health status, factors that influence health and community needs, Sally's whole career is built on the fact that she was a firsthand witness to some of the uglier side of infectious disease and the really difficult conversations that have come out of some outbreaks throughout history. So currently her team works with epidemiologists who work in infectious disease. They better help to better understand their populations, to really understand the language barriers that come, or just communication barriers in general that come with populations at risk, and really bring to light some of those informational aspects of, some of these populations are not going to understand the scientific jargon that's used by epidemiologists, and so they really are a deployable resource for at-risk populations, and they really bridge the gap between the investigation teams and the people at risk. Communication is a big part of Sally's job, so providing those trainings and being able to work with public health partners. Recently, they worked with health partners on syphilis testing. Oklahoma ranks third in the nation for syphilis cases. And they work with partners on creating equitable discourse and for persons experiencing homelessness who are also negatively impacted by the syphilis rates in the state. Sally's team is currently planning a mutual aid fair. They're mobilizing communities and external partners to work with persons experiencing homelessness and other populations experiencing health disparities. This fair will be in both of the major metro areas, Oklahoma City and Tulsa. It's going to provide free STD testing, health hygiene products, and some additional health screenings. One thing from Sally's history as a public health practitioner is that She began to support legislation within sexual health on and harm reduction that would legalize syringe exchange programs. This started in 1999, and we finally saw something like this pass in Oklahoma in 2022. A lot of what this team does that work under Sally and what Sally's job entails is working in groups that are constantly trying to improve the way that systems work. So, working through surveillance and making things flow well within the agency. They also work through improving the trainings that we do with external partners and working with those who would that could use some assistance in creating consumable information. So they really work in a variety of different roles to help make sure that public health is functioning to the best of its ability. Some advice that Sally gave me towards the end of our interview was to stay up to date on research, to know what populations are being disproportionately affected by different diseases, to make sure to understand the whole person instead of just one aspect of that person, which for the department that I work would be an emerging infectious disease. So to make sure that you understand what factors are influencing health. She also mentioned to learn to take wins as you get them, since working in the government can be difficult. There's the example of the bill she was championing in 1999 that finally passed in 2022. It wasn't the same bill, obviously, but it is something similar with harm reduction. And so just learning to celebrate the little wins and understand that you're doing good work no matter what. And that is all I have for today.